We're just going to assume everybody's going. Hey, last month, thank you for being patient while we muddle through some issues. Hey, Melinda, can you hit the record button at the bottom if you see it? We are live on Facebook.
I will record to the cloud. It's recording.
Thank you. Hey, thanks for being patient with us while we get our act together here. As you recall, last month we talked about the intersection of militarism and climate change. Tonight we wanted to talk about another link, this time to our healthcare crisis. Just to give you a couple of quick figures, through fiscal year 2020, the United States federal government has spent or obligated $6.4 trillion on wars in Afghanistan, Pakistan, and Iraq. That amount is obviously very hard to get your head around. It comes to, however, almost $11,000 per second for the past 19 years. Get that? That's maybe even harder to get your head around. But it's $11,000 per second. And unless the U.S. immediately repays the money borrowed for war, there will also be future interest payments that could total as much as $8 trillion by the 2050s. It's just out of hand. Spending on wars has also involved opportunity costs for the U.S. economy that are very hard to total up, and our healthcare system. And that's much of what we want to talk about tonight. With 205,000 dead and 7 million infected, something is obviously very wrong with our priorities in this country. As always, we'll follow up with an email tomorrow highlighting what you can do about this crisis, so keep an eye out for that. We also wanted to highlight another healthcare crisis, and that is that of the veteran. We asked these veterans to go off and die in our endless wars, basically as cannon fodder. And we're joined tonight by someone very special that's going to speak to the healthcare crisis facing veterans. But before we do, I'll get some introductions done in a second. I just wanted to let you guys know, attendees will be muted for the duration of the webinar. There is a Q&A box that will be monitored, so please put any questions for the panelists in the Q&A box, and we will get to them later. That's assuming I can figure out these technical difficulties we're having. In the meantime, I wanted to introduce both of our panelists. I'm very proud and happy to be joined by a local veteran activist, Jan Barry, who's been a huge supporter of New Jersey Peace Action, as a matter of fact, over many years. Jan Barry is an environmental journalist and author of A Citizen's Guide to Grassroots Campaigns. A Vietnam veteran active in Veterans for Peace, he teaches environmental studies at Ramapo College. His newspaper investigations into Agent Orange health issues helped foster scientific studies and legislation to provide VA health care for many affected veterans. And Jan will be speaking on, obviously, the healthcare crisis meeting our veterans. Following Jan, we're going to be joined by Melinda St. Louis, who's on screen with us as well. Melinda is the director of Public Citizens' Medicare for All campaign. For the last 20 years, Melinda has led multiple campaigns that challenge corporate power and promote economic justice and human rights, including fighting big pharma greed in global trade agreements. She's now thrilled to focus her energy on building a movement to finally deliver guaranteed health care for everyone in the United States. She received her master's degree in public policy from Georgetown University. So Melinda, thank you very much for being here as well. Jan, we're going to go to you first. I'm not sure I can control the video off and on. So we're just going to leave who's ever on screen for now until we can figure out our difficulties. But Jan, if you could speak to the healthcare crisis, and I know you can speak with some personal perspective on it, we'd love to hear from you on this topic. So take it away, Jan.
All right, thank you very much, Jeff. Hello to everybody who's joined us. I realize a few other things are going on tonight. Back in the winter, before we knew that there was a COVID virus that was going to turn into a pandemic, I came down with a weird health problem in which I basically was losing my balance and sometimes could barely walk better than how a duck waddles. So I, of course, thought it probably was inner ear. And I went to a specialist about inner ears, and no, that's not what the problem was. And I also changed my primary doctor from somebody who didn't really listen to what I was saying to somebody who I knew, because a friend has the same doctor, might be more willing to listen. It turned out also he had worked at one point at the VA. When I described my symptoms, he said, well, I might have peripheral neuropathy, which I had to look it up. It's not something that generally I had encountered. Nobody in my family had ever had such a thing. And as soon as I did a quick research, it's on the most recent list of illnesses that the VA say are associated with exposure to Agent Orange. So I signed up with the VA to get checked out by the VA. I previously hadn't gone to the VA for a couple of reasons. One being that for years I had newspaper jobs in which I had healthcare coverage. And when I hit 65, I've been on Medicare coverage, which I'm going to come back to in a minute, because the VA fails lots of veterans in many, many, many ways. And for Vietnam veterans, many people have been turned away since they came back from Vietnam. On one thing or another, the VA would say, oh, didn't happen in Vietnam, it's your problem. So it didn't surprise me whatsoever when I went to my VA appointment, which happened to be in the middle of March. And a young doctor said, yes, you have peripheral neuropathy, but I have to have my unit chief take a look at you. And this older guy comes in, doesn't even pay any attention to anything, and says, it's got nothing to do with Vietnam. It's genetic. And in such a tone of voice, you're not supposed to argue with him. He's just issued the law. At this point, I'm more worried about the fact I'm in a hospital and there's signs all over the hospital talking about there's something to be worried about. I just wanted to get out of there. And as it turned out, shortly after that, the VA in East Orange started having lots of cases of coronavirus. Even worse was the veterans' home in Paramus, where dozens of people died, and the veterans' home in central Jersey, where even more, I think, died. And actually, living in Teaneck, I was surrounded by people dying of this new disease, because there's a hospital in Teaneck that took many of the early patients. My primary doctor had said something to me early on. It was like, how can I absorb all that we got to deal with? He said, try taking a certain, not quite a medication, it was a boost of vitamin Bs. It's a name for it, Botanix. He says, it might work after a while. All of a sudden, one day I could walk better. But I've continued to be able to walk better enough that I can walk sometimes a mile a day. But it comes in patches. There are days in which I'm still struggling to do a normal step. If I walk between a table and a chair, for some reason I start losing my balance, like I'm walking on a tightrope. That's just to give you an example of, this is a weird combination of illness problems that I never in my life expected. When I got to be in my late 70s, this is going to come back to bite me from Agent Orange exposure in Vietnam in the 60s. And so this is what many veterans are dealing with. There's a long list of many other diseases, most recently including ischemic heart disease, which fortunately I don't have, Parkinson's disease. But in many cases, it's a catch-22. With peripheral neuropathy, the VA will treat you if it's proven to be at least 10% disabling within 1 year of contact with herbicides. When I was in Vietnam in 62 and 63, they never told us about herbicides. It was years before I discovered that there were such things. In the late 70s, I did one of the first newspaper investigations into what is this? Does it really potentially cause health problems? And even doing those investigations, I thought, I never remember seeing any spraying, so I must be okay. It turns out many, almost decades later, it was in the water supply. We were exposed to it by what we were drinking. There's a whole pattern in which the United States government refuses to tell people that they were in danger of something, starting with being in the military, but even the public isn't warned about a number of things. The outcome for many Vietnam veterans was to form their own campaign during the 1980s. It took 10 years to get some traction, and it also took a change in administration from a Republican president to a Democratic president, with more Democrats in Congress, to finally pass some legislation around 1990-91 that enabled Bill Clinton to sign this legislation that required the VA take a serious look at this, and every 5 years, I think, do a review. And every time they did this, they would add some more. This is based upon doing surveys of medical literature. A lot of it comes from Europe. They've studied this stuff in Europe. The United States government does not want to know the answer. Therefore, they can't find any studies that have been done. For younger veterans, since going into Afghanistan and Iraq, one of the issues has been breathing in the smoke from burn pits. They had burn pits in Vietnam as well, but that never got to the point at which anybody could get the VA to pay any attention, let alone do anything about it. The burn pit campaign here, more recently, has taken years upon years upon years to finally get to the point in the last year. Some bills have been added as amendments to the ordinary defense bill to get at least some traction, that there's a registry that people can sign up to be on, that the VA is supposed to take this seriously. Well, the VA, again, is saying two different things. One is they have to look at every individual case. They can't simply say, oh, you were in Afghanistan, you probably were exposed to something like this, which is ultimately what happened with Vietnam veterans. Previously, for years, Vietnam veterans had to prove that on a certain day an airplane came overhead and sprayed something on them, which is very hard to prove. But the Obama administration brought in a guy who was a retired general who had served in Vietnam, and he said, forget about all that baloney. If you served in Vietnam, you were probably exposed. All you have to do is show the paperwork that you served in Vietnam. And then the people who were in the Navy started howling and screaming and saying, well, what about us? At first, even I thought, well, wait a minute, they were out to sea. Well, the Australians, who also had Navy units in Vietnam, did the research. It was coming in by taking in water, which comes off the rivers in Vietnam with the contamination in it. And the water is used for cleaning things. They also have ways that they can turn brackish water into drinking water. And sure enough, the Australians showed, yes, some people could get enough contamination that they could have some of these diseases that are on this growing list. It's a bunch of cancers. I'm leaving off a whole bunch of things, but the fact that it just kept growing roughly every 5 years when the VA had to accept research that had to be updated. And almost every time, particularly when Republicans are the president, the VA doesn't want to do anything, nothing. So for Vietnam veterans, it's a roller coaster. When Democrats get in there, something happens. Republicans come in, nothing happens, or you have to fight like hell to get any kind of assistance. Unlike the campaign that Veterans for Peace and other veterans organizations have been waging to save the VA, I have a different perspective. I really think that everybody should be on Medicare Plus, meaning that if you're on Medicare, you still have to come up with another 20%. That has to be changed. If everybody since I was on Medicare and had enough money so far to pay that extra United Healthcare is the plan that I got onto. It has worked out so far for me. And in this most recent situation, I have found that civilian hospitals and doctors, when I push them hard enough, give me more assistance than fighting with the VA, in which I'm getting nowhere other than the same story from the late 60s. Has nothing to do with your service in Vietnam. It's genetics. Your mother gave it to you. Which is a slap beyond an insult in the face. Same thing is true of post-traumatic stress disorder. Vietnam veterans are told, oh no, you got that from your life before being in the military. It's not our problem. As a result of being, met by such a stonewall, Vietnam veterans who did get active learned a lot about how to network, how to work with other groups, because we're getting nowhere by ourselves. And with post-traumatic stress disorder as an example, lots of people can get that from all the things that happened in life. But each one of those groups by itself couldn't change much of anything. And so one of the things that has been kind of an untold story, which applies to the peace movement as well, is how to network, how to reach out to just all kinds of organizations. Veterans that include the American Legion, the VFW, which initially didn't even want to have Vietnam veterans as members. In the late 60s and early 70s, they were older veterans who said, you lost your war, we don't want you around here, Sonny. Even if somebody came from that town, that attitude has now changed because that generation is now basically died off. Now Vietnam veterans are the age in their 60s and 70s who run these organizations. And from the very beginning of forming their own organization called Vietnam Veterans of America, that group said, we're not leaving any other veterans behind, meaning if veterans of these newer wars have health problems, we're going to back them up. And so I had to look up on Burn Pits 360, a website, what the latest information is. But in the past year, some legislation regarding assisting people exposed to burn pits moved through Congress by attaching it to the defense legislation. Again, it's come down to people pushing to get assistance that they've been promised. At that point, I think I'll end here in terms of waiting for people to provide questions.
Okay, can people hear me?
Yes. Yes.
Yeah.
I joined through another, I have no idea if this is going to work, but I gave myself panelist rights with another email. We'll see how this goes, even though I look like I'm in here 2 and 3 times. Thank you very much, Jan. That was very informative. Folks, please leave your questions. So there is a Q&A box down below. Please put any questions you have in there. Melinda, you've been working on this subject for quite a while. And I know one of the things that Public Citizen has looked at is how to pay for all this and moving the money perhaps from the Pentagon budget. I really want to hear, and I know that the audience wants to hear everything you've been doing on Medicare for all, universal health care, but also how we afford to do this kind of thing, because it never seems like we have the money to do the right things. We certainly have enough money to do all the wrong things. So I'd love to hear your thoughts on that as well. Over to Melinda. Thank you very much.
Great. Thank you so much. I'm going to just share my screen really quickly for folks. Let me grab the, let's see, I want slideshow from the beginning. Okay. So Thanks again to New Jersey Peace Action and the organizations that sponsored this for having me with you today. And thank you, Jan, for sharing your story and for the heartbreaking stories of veterans and the mysterious illnesses and the fights that you've had to wage over the years to be recognized and to receive the health care that you need. And so again, I know that that is a painful story to tell, and so I really appreciate you sharing that with us tonight. I wanted to share a little bit about Public Citizen's work in this space. Public Citizen is an organization that was started by Ralph Nader back in the early 70s, and over the years has been really the people's lobby in Washington, D.C. We have a litigation group that has brought many class action lawsuits on behalf of consumers, on behalf of workers, all the way up to the Supreme Court. And then we have a robust public education and grassroots organizing campaign as well. And healthcare really embodies the fact that we have outsized influence of large corporations that are dictating policy that is both inhumane and inefficient. And actually makes no sense except to provide profit to the wealthy. And so I think that this is a really important topic tonight about looking at both militarism and healthcare, because there are connections, as we've already seen. So I will look first at how the Pentagon wastes billions of dollars that should be going to human needs, as Jeff mentioned at the beginning of this webinar. And Public Citizen also has a campaign called People Over Pentagon. So I'll refer a little bit to that work as well. Then talking about what's wrong with our current healthcare system and who is profiting from this status quo, why Medicare for All is the solution, and improved Medicare for All, as Jan was mentioned earlier, and then how we can work together to end wasteful Pentagon spending and achieve Medicare for All.
Not working anymore?
Well, it's not working and I can't see it at all. I'm sorry, everyone. I think my computer is now freezing. So
we can still hear and see you. If you want to just speak towards your work on Medicare for All.
Okay, all right.
I will do that.
I had some good facts that I would like to be able to pull up for you all, but I will. Let's see. I think maybe here it is again. Okay.
We've got a lot of storms moving through the Northeast. I'm wondering if that's what's going on.
Yeah, I'm not going to worry about sharing my screen. So thanks for your patience. I just want to begin by, reiterating that our priorities in the United States are all screwed up. Our military spending is absolutely out of control. And I think everyone on this webinar already knows that. But the US now is spending more in the military than the next 9 countries combined. It was 7 countries, but now it's 9 countries combined after Donald Trump has continued to increase the military budget. Military spending makes up 53% of the discretionary federal budget. That's more than the spending that we have on education, federal courts, affordable housing, local economic development, and the State Department combined. All of those together do not even reach what military spending is in our budget. And just as a point of comparison, since we're talking about healthcare, the Center for Disease Control, which we recognize during a global pandemic has been absolutely critical for us. The annual budget is around $8 billion. That is barely 1% of the total Pentagon budget. And as I mentioned, the Trump administration has increased the Pentagon budget by $120 billion in the last 3 years. So this past summer, $740 billion was approved by Congress for the Pentagon. And yet the Pentagon has continually requested and received billions in COVID-19 relief and aid that is critical to be going to hospitals, et cetera. And the Pentagon, last week, it came out that they misspent at least $1 billion in COVID relief funds that were supposed to go towards masks and protective equipment. Instead, it went to jet engines and body armor. So we are seeing the Pentagon as an example of waste and abuse that is not keeping us safer, and obviously the interminable wars, all of the resources that are going to actually to harm people elsewhere, and then also our own soldiers and veterans that are then struggling with their health when they come back. So meanwhile, we're spending all the money on the Pentagon. Meanwhile, our healthcare system is broken. 30,000, the estimates are that 30,000 Americans die each year from a lack of healthcare coverage. That's nearly 100 preventable deaths each day, and that was before COVID-19. Nearly half of adults before COVID-19 reported not going to the doctor when they were ill or injured in the last year because of cost. 1 in 3 adults reported that they skipped medical treatment that they needed because they couldn't afford it. 1 in 5 said they skipped a prescription or cut pills or skipped pills because they could not afford their prescription drugs. And our outcomes is that our infant mortality rate is 25% higher than in Canada. It's practically triple the rate in Japan. And we rank 43rd among the world's nations for life expectancy. That's behind Cuba, that's behind Costa Rica and Chile, among many others. And yet, so we have terrible outcomes, but we spend much, much more than our peer countries on healthcare. Double most industrialized countries is what the United States spends on healthcare. Up to 18% of our GDP is being spent on healthcare, and our prescription drugs are higher than anywhere else in the world. And in fact, we actually already pay more in public money, in tax money per person than most of these other countries pay total. And that's countries that provide universal health care. So we're already spending in our tax money more than these other countries are paying. And yet our outcomes are terrible, and we do not cover 30 million people. And that was again before COVID-19. So COVID-19 pandemic has laid bare, we already knew this, but now we can't ignore it. Financial barriers remain for testing and treatment for both insured and uninsured people, despite the CARES Act, despite the promises of the insurance companies. We're seeing examples of financial barriers to COVID care. 12 million people now estimated have lost their insurance along with their jobs. Actually, it's been many more than that, but 12 million have not been able to replace their insurance at all yet, and so are now newly uninsured. And then the fragmented nature of our healthcare system has meant that it's been harder for us to track how rapidly coronavirus is spreading, to be able to get equipment to where it's needed, because our system is set up on profit, not on where the healthcare is needed. And so why are our health outcomes so poor? As I mentioned, the United States is the only rich country that does not provide universal health care for its population. Even after the Affordable Care Act, which was an important step forward, nearly 30 million people were uninsured before COVID. Now add another 12 million to that and counting. But yet there are also more than 40 million underinsured. So that means people who have crappy insurance, that their co-pays and deductibles are so high that they can't afford the care even with their insurance. And what that has meant is that 2/3 of the families that declare bankruptcies in the United States do so due to crushing medical bills. And that is not just the uninsured. As many of you who have insurance may know, surprise bills are real. People go to what they think is an in-network hospital, and then there's an out-of-network doctor or radiologist or anesthesiologist that comes into their surgery, and they get billed for tens of thousands of dollars. And it's happening every day across this country, even for people with insurance. The financial barriers to care in our system has also meant massive health disparities by race and income. Zip codes that are just 5 miles apart in some cities have a difference of life expectancy of up to 20 years. So on one side of the tracks, life expectancy is 55 years old. Other side of the tracks, it's 78 years old. And we're seeing this in cities across this country because of the financial barriers to care that exist in the United States. And we have seen that with COVID, immensely disproportionately higher mortality and morbidity rates for COVID-19 among African Americans and Latinx people. The problem is not just the uninsured, as I mentioned. One example, there was Danny, who was uninsured, was charged $34,000 by a Massachusetts hospital for his COVID-19 treatment. And for people with insurance, hospitals are price gouging like crazy, up to $9,000, $20,000 for sometimes for tests and for treatment. So why is it so expensive without providing adequate care in the United States? Well, it's because we have a fragmented system and it's multi-payer. And what does that mean? It's 1,000 different payers, private insurance companies. It generates enormous administrative waste. It has nothing to do with providing care. 1 in 3 healthcare dollars does not go to healthcare. It goes to bureaucracy and it goes to profit making, because the primary goal of private insurance is to generate profit for shareholders. It's not to provide care. So there is incentive to deny care, to be able to bring more in premiums than they pay out. And so that is the business model. That's what healthcare is in our country. We're the only rich country that doesn't use the negotiating power of our government to bring down costs for pharmaceuticals and medical devices. And that's because of the outsized influence of the pharmaceutical companies in our in Congress, that they have gotten sweetheart deals that make it impossible for them to negotiate. So estimates are that our fragmented system leads to $600 billion per year in administrative waste. So when we talk about what we can afford, what we cannot afford is our current system. That is where we're just siphoning off money, just like we are with the Pentagon. So imagine $700 billion at the Pentagon, $600 billion in administrative waste because of our profit-driven healthcare system. Who's profiting? United Healthcare, the largest private health insurer in the country, posted record profits during the pandemic, $6.6 billion in 1 quarter. That was during the pandemic. Imagine the incentives in the fact that we're laying off doctors, laying off nurses in hospitals around this country. Hospitals are closing. They're filled to capacity. And the private insurers are making more than they ever have before, hand over fist. Something is drastically wrong with our system. And the thing is that we know we can do better because we already do better under Medicare. As Jan mentioned, Medicare needs to be improved, but Medicare, which provides universal coverage to everyone over 65 in the United States, has overhead of 2% administration for Medicare. Private insurance spends between 12 and 18% in overhead on administration. And so you see that this whole idea of private enterprise being more efficient, that is not the case under Medicare. And remember, Medicare covers people over 65, the population that consumes more healthcare than any other population, and yet Medicare is doing so much better. So there's a common sense solution: improve Medicare and expand it to everybody. There are 2 bills in the House. In the Senate, HR 1384, which was introduced by Representative Jayapal and Representative Dingell. And then in the Senate, S 1129, it was introduced by Senator Sanders. These are bills that would do just that, and they are gaining momentum in Congress. So let me tell you just briefly what Medicare for All Act, these bills would do. They guarantee health care for everyone. And how do they do that? They improve and expand Medicare to cover everyone residing in the United States for their entire lives. Punto. Okay, everyone is covered. What's covered? Comprehensive benefits, including dental, including vision, including long-term care, which is a huge worry for people under Medicare currently, that is not covered. reproductive services. So everything that hospitals, doctor visits, prescription drugs, everything covered with, and a complete freedom of choice of doctors and hospitals. No more in network and out of network. Everyone is in the system. All providers are in the system. So much more choice than we currently have, and eliminating all premiums, co-pays, and deductibles. All out-of-pocket costs are gone. Does this sound pie in the sky? It is not. I know it's in our country. We've been told that this is impossible. It is possible in so many countries. And how do you do that? You simplify the healthcare system and move to the single payer model. Get rid of the 1,000 different private insurers, have one payer so hospitals don't have to spend all of their time on billing, doctors fighting with different insurance companies, all of the different paperwork. It goes straight to one payer. It is not government run healthcare, because hospitals and doctors are still private enterprises, but they bill Medicare. That's the only difference. Prevents providers from using payments from the program for profit and for marketing. That's where so much of these billions of dollars are being wasted. And it provides global budgets to hospitals. So what that means is that hospitals get the money. They don't just bill for every, MRI that happens. They get a bunch of money that is for providing care for their community. So that's when you have a pandemic, this hospital needs more money. We're going to give it to them now. And so it has a lot of incentive to both control costs and to put resources where they are needed. And it allows Medicare to negotiate drug prices finally, so we can bring down the cost of prescription drugs. And it would save trillions of dollars. And so that, getting to your question, Jeff, of how do you pay for it? How do you pay for what we're doing now? We cannot afford the status quo. All the economic models that look at these bills and look at what we would be saving show that we would actually save money over what we're currently spending of health, system-wide. The Koch brothers funded a study to try to show how Medicare for All wasn't going to be, you couldn't actually afford it. And they accidentally found that it would save $2 trillion over 10 years. And that was the most conservative version. We've $5 trillion over 10 years, as the University of Massachusetts found. We save money under the system. And for families, what that means is savings for almost everybody except the absolute wealthiest, because we are paying insurance premiums. If you're lucky enough to have insurance, the average family plan is $21,000 a year now for premiums. Your employer may pay part of it, you pay part of it, but all of that comes out of your wages. So if you didn't have to be paying that, it is a highly regressive tax that we are already paying. And what we need to do is shift it to a progressive taxing system so that the fair share is being paid by people in higher income brackets. And for almost all of us, it would be less than we're currently paying for healthcare, even with the increased taxes that you would need. So that's why over 200 economists support Medicare for All. They say public financing for healthcare is not a matter of raising new money for healthcare, but reducing total healthcare outlays and distributing the payments equitably and efficiently. So to get out of this absolutely inefficient system that we have. And this would be absolutely critical for everyone, but as in this moment of racial justice reckoning in our country, we absolutely need this as part of that reckoning to reduce racial inequity in our health system, because the uninsured are overrepresented, people of color. In some states, as high as 80% of the uninsured are people of color. And it would, again, direct research and resources to improve health equity where it's needed, instead of based on the profit making of the population that's being served. And so all this to say, the political momentum for Medicare for All really is growing. I'm sure folks have heard a lot about it. 10 years ago, 5 years ago, you were not hearing about this. It's become a more mainstream position, definitely within the Democratic Party. But actually polling shows that when you explain what Medicare for All is, Independents and Republicans also support it. All exit polls from the Democratic primary showed a majority of voters supporting Medicare for all, regardless of the candidate that they supported. That included Florida and Texas, places that you don't expect it. And since COVID-19, polling has shown that the majorities of support have gone even higher, because now there's just, as people lose their jobs, they know they can't trust that they're going to have their employer-based insurance tomorrow if you might lose your job. And so we need to completely transform how we provide healthcare. So how do we win? And I think we really have to build a movement. That's why I'm excited to be talking to all of you today. There are these bills in Congress. I will share the details in the chat, and happy and links. If your representative has not signed on to HR 1384, and in New Jersey, several have not. New Jersey, I think, being an insurance state, it's been hard to even get the Democrats to support this. So call your representative. Senator Booker has supported Medicare for all legislation, but we need to first get the Democrats on board. We have 119 co-sponsors already in the House. It's more than half of the Democratic caucus, which is extraordinary momentum. We had hearings on this. This is really moving in a way that it hasn't over recent years. But I can share, you can find out if your member is co-sponsored and call them. And we need to respond, and right now, responding to the emergency that we're facing with COVID-19. And then the other thing I wanted to mention to folks is that we have a really exciting grassroots, like from the bottom up campaign to pass local resolutions in support of Medicare for all in city and county councils across the country. And there are more than 300 of these efforts underway. We have a really comprehensive toolkit that makes it easy to be able to contact your local council person, bring together a local coalition, and to push this through as a way for us to signal to Congress that this is a movement that is growing. And in fact, just in the past month in New Jersey, there have been Red Bank, New Jersey, Maplewood, New Jersey, and Essex County all passed resolutions in support of Medicare for all. And we know our Revolution, Monmouth, and the New Jersey Single Payer Coalition has been, Universal Healthcare Coalition has been active in this. And we're really excited. We want to get small towns, we want to get big cities. And I know that there's some efforts to try to push in Newark and elsewhere, Jersey City. So if folks are in any of these areas, I'll put in the chat the web address, and you can sign up and see on our map where you can, if your town is involved, we can plug you in, or we can help get you started. And I did just want to mention that just last Wednesday, we had this very exciting virtual town hall with Senator Bernie Sanders and Representative Jayapal and Representative Ayanna Pressley, and really high level folks from around the country talking about this campaign. You can go to healthjusticetownhall.org to watch that really exciting town hall. And then the last thing I'll say, and I'll close, is just to also mention that Public Citizen is working in a big coalition of the People Over Pentagon agenda, which I know is also near and dear to everyone's hearts here. And the goal is to reduce military spending by at least $200 billion annually. That would free up $2 trillion over the next decade to invest in healthcare, to invest in human needs and in education. And we can do that by eliminating tens of billions of dollars in waste and fraud from bureaucracy, redundant personnel, overpriced spare parts, weapon systems that have experienced huge cost overruns. This budget is bloated to the hilt, and you can cut $200 billion and barely notice it. And we have guidance of where these cuts can come from very easily. And we need to obviously stop waging these unnecessary and counterproductive wars, as was mentioned. So you can go to peopleoverpentagon.org as well. So I'll share some of these links in the chat, and yeah, happy to answer any questions.
Thank you very much, Melinda. That was really eye-opening. We do have a number of questions coming in, and because of our technical fun and games we're having here tonight, I'm going to go right to them because we're running just a little late. Hopefully our speakers can hang around for just a couple of minutes if we can. Just so everyone knows, there's been a couple of things going on in the chat window. The only two House representatives that have co-sponsored 1384 are Donald Payne and Bonnie Watson-Coleman. So in North Jersey especially, all over Jersey, we got our work to do. And we'll talk more about that with the follow-up email and things like that. Our first question is for Jan, and it's from Lisa Binder, a longtime supporter. Jan, how can other organizations be supportive of the vets as they encounter problems such as the ones you've mentioned this evening?
Sure answer is it's very difficult. That's why each one of these campaigns is taking years upon years upon years upon years. I frankly feel we need to put all of our efforts into shifting the whole system, just as Melinda was talking about. Now is the time to do it. We could wage the next 10 years trying to do something about the veterans who have been exposed to burn pit damage. Well, if they could go to a civilian hospital tomorrow, they just go there.
Very good. Okay. And if we stop creating new veterans every day of the week, that would probably be a big help as well.
Yes.
First, Melinda, Colin Minard asks, Medicare coverage, Medicare for all. Which of the following would be covered under the House and Senate bill? All residents, all citizens, immigrants, legal, illegal? Who would be covered by the bills that are currently going through Congress?
The current bills would cover everyone residing in the United States. So that without so with no question about document status or anything, anyone residing in the United States.
Very good. Okay.
Would be covered from cradle to grave. You're born, okay. You're covered. Yeah.
Good. Has another attendee asks, has our healthcare system always been a for-profit system? And if that's a recent change or one in our brief history, can you go into a little about that?
That's a great question. Our system has been a for-profit system. It has gotten more and more bloated, and the profit in the system has become a bigger and bigger part of it. But yes, I mean, Medicare was passed in the 1960s. So prior to that, seniors in our country, this was, prior to Social Security and then Medicare, the vast majority of seniors lived in abject poverty. And this was a huge, important element of our society to protect seniors and to provide them with, Social Security benefits and then also Medicare. And then, as I mentioned, we already spend more in our tax money per capita on healthcare than other countries do that provide it to everyone, because we cover Medicare, we have the VA, we have Medicaid, we have TRICARE, and then we have to pay for the private insurance for all government employees. So anyone who works for the government, we're paying out of our taxpayer money their healthcare premiums that are extremely expensive, like members of Congress, but also anyone who works for your city if they have coverage. All of that is already taxpayer money. But because we have this just like fragmented and very, bureaucratic heavy system, what that means is that all that money is just being squandered. $1 in $3 is being squandered instead of going to care. So if we are able to redirect and actually have a single payer system that's much more efficient, then we can cover everyone, and it actually costs less than what we're currently spending.
Thank you. So veterans would be covered by Medicare for all.
Yeah. Mhm.
So
And
that would obviously.
the way Medicare for All, the bills are written currently, the VA would continue to operate as well. So veterans would have a choice. If they wanted to go through the VA, they could, but they also, because the VA actually is government-run healthcare. I mean, that's where they are government employees, the doctors and everyone who works for the VA. Medicare for All would maintain the system that we currently have in terms of the providers, but then there would be Medicare would be the payer, would be the insurer. And so veterans would be able to choose.
Great.
Let
Thank
me
you.
add something else that I discovered since I wasn't previously in the VA system. I make too much money.
Mm.
The way they've set it up currently, I'm income from Social Security, a modest pension, and teaching part-time. I make too much money.
Mhm.
So it isn't that it's free to all veterans. You have to be in poverty to actually make use of the system. And then, of course, you have to jump through all kinds of hoops to prove you have the health problem that you have. So after all the trouble that I spent last winter, after going through all the paperwork, I get a letter from the VA a couple of weeks ago saying, I don't qualify to be in the VA system.
Wow. They get you going and coming. Howard Lipoff asks, I heard that Biden is calling for making eligibility for Medicare go to age 60. Is that correct? And if enacted, how much would that help?
So yes, that is part of Biden's platform, is to lower the Medicare age to 60. Our view is that anything that increases Medicare is the right step, and it's a step in the right direction for sure. We would urge for that to be much lower than 60. Obviously, we want it to cover everybody. And we also think another interim step would be to cover all children, because there still are millions of children in the United States, even with the CHIP program, that do not have health insurance. But what's an important piece for us is that as we expand Medicare or lower the eligibility, we really need to go to stop the privatization of Medicare that is happening under Medicare Advantage plans, and private insurance companies that have been kind of infiltrating Medicare so that would be an important piece to tease out. We would want any expansion of Medicare to be an expansion of Medicare and not of these private insurers that are kind of siphoning healthy people out of the Medicare system and then dumping them back on once they get sick, which is what we're seeing through Medicare Advantage plans.
Thank you very much, Melinda. I'm going to actually take this. Carol Gay asks what percentage of the military budget is that $200 billion you referenced? And it comes to about 27% of the current figure. Mm-hmm. However, it's really far less than what's really truly spent on the military, because the $740 billion, even though a humongous number, is really probably only 70% of what is spent. And there's all different kinds of estimates because so many things are hidden in the budget that we don't even know about. Carol also asks, would Medicare for All do away with waste from drug company advertising?
Well, the way my understanding of the legislation is that Medicare dollars could not be used for profit or marketing. And so that would be a big piece of, and Medicare, the Medicare bill would include in it, again, allowing Medicare, which is current Medicare is the largest purchaser of prescription drugs in the world. And yet, by law, Medicare is not allowed to negotiate with the drug companies. That they snuck that into the Affordable Care Act. So what that means is that, whereas in every other country, if you're bulk purchasing, you can say, this is how much we can pay or negotiate that price down. In the United States, we cannot. And so it would include drug negotiation. And then it would have an important element that if the drug companies refuse to negotiate, then the government could institute what they call compulsory license, which would allow generic companies in. Basically say, you know, we've granted you a patent to charge a monopoly pricing. If you're not willing to negotiate with us, then we're going to let generic companies in and actually let the free market figure this out. And the drug companies don't want that. So that's the stick that they would use to be able to bring some of those drug prices down.
That's great. Melinda, would you be able to share your PowerPoint with me so I can get it out to the registrants?
Yes, absolutely. Yeah, and I apologize. That the screen share wasn't working.
Yeah, not sure what's going on with the system. We've never had this kind of problem, kind of system-wide. So we're coming up on our time. I have a couple of quick questions that I'll ask after this, but I want to thank everyone for being here tonight. Melinda and Jan especially, but all the attendees as well. Thank you for your patience tonight as we struggled through this. I don't know what is going on with Zoom night, but we made it through it. And I think it was a great information for everyone here. I'll get an email out tomorrow. There are specific things that New Jersey Peace Action is working on, which is people, and it includes the People Over Pentagon initiative, our Move the Money campaign, which is obviously very related to that, and a lot of things that are specific to certain weapons systems, nuclear weapons as well. So we'll get some specific things out to people, but also the bills that Melinda referenced, and I'll talk to Jan about what else we can do there to help the veterans cause, because that's just, you know, just such a cruel way of treating folks who have put out so much for our nation over time. It's just so wrong on so many levels. And a bit off topic, but there is something coming up on the ballot. And the other thing I want to stress is vote. I don't know that there's been an election that's more consequential in the history of our country going on November 3rd. Ballots are obviously already coming out to people in New Jersey. Everyone in New Jersey is going to get a mail-in ballot. Please process it. If you have any questions at all about get out the vote type stuff, where your ballot goes, call the office, 973-259-1126, and we will try to help in any way we can. Jan, on the topic of the ballot that's going out, there is a public question, tax relief for peacetime veterans. Can you speak to that and what your opinion is on that public question by any chance while we've got you?
I had to look it up because I hadn't seen any information about it.
Okay.
By $250 as a tax credit, even if you didn't serve in a war zone, or the widow get that, which is a good thing to do. I was able to finish college because of a New Jersey scholarship for Vietnam veterans. Nobody advertised it. If I didn't learn about it, I would never have been able to make use of it. So in ways that really matter, this is something that's not a whole lot of money, but often can help a lot, particularly when you're retired, to have to, you know, be paying property taxes without some sort of assistance.
Okay. For those folks raising their hand, if they could type into the Q&A box, because there's no way I can see who's raising their hand. So, and we're going to have to call it short anyway. There is one more question I would like to ask. It's interesting to me as well. Is there any accounting available to voters of what the healthcare system in general spends on campaign donations to specific representatives and senators? Is there any type of database out there for that kind of thing, Melinda, that you know of?
I'm sorry, can you repeat that? You cut out for a second.
Any kind of accounting of how much different House representatives and senators have taken in campaign donations from the healthcare system?
That is a great question. I am not sure if that is consolidated. I know that that we have pulled some of that information, but I will investigate, and I will, if I find something, I will send it to you, Jeff, to share with everyone.
Thanks very much, Melinda. Well, listen, we ran over time. I really thank you very much. Melinda, thanks so much for being here. Great job, great information. I'll follow up with you on some follow-up things for the rest of the attendees so we can make sure we're on the same page as to what we're letting people know. We always like to end with something on, you know, what can you do about it? So I'll be sending out something tomorrow on that, and I'll touch base with you folks. Jan, thank you very much. It's always good seeing you. Say hello to Paula for me.
Thank you very much.
Does anybody have any closing remarks that they'd like to make before we sign off? Okay.
I did just put in the chat a link to a Google Drive my presentation, but I will also share that with you. You can put it out in the email, but I just put the link.
Very good. Well, thank you all for being here. To all the attendees out there, I'm not sure whether you're seeing me, but it was really great seeing you all tonight. Thank you for your patience while we got our act together earlier in the evening. We'll see you again all very, very soon, and I'll be in touch with everyone tomorrow via email. Thanks again for being here. Have a great evening. Stay safe, stay healthy, because we know what our healthcare system is going to do to you if you do the opposite. So thanks.
Okay.
Talk to you all soon.
Bye-bye.
Thanks, Jan. Thanks, Melinda.
Bye.
Bye-bye.